Gentlemen, if you've noticed that the firm morning erections you once took for granted have slowly faded over the years, you're not alone. Many men assume it's simply the unavoidable result of aging. But what I'm about to share may surprise you because the real cause is often far simpler than most people realize. A recent clinical observation involving more than 270 men revealed something remarkable. If the gradual loss of morning firmness in many cases has less to do with age itself and more to do with the weakening of a small but extremely important muscle in the pelvic region. When this muscle loses strength, it becomes harder for the body to maintain strong blood retention during an erection. I'm Dr. Rebecca Stone. And for many years, I've worked with men dealing with changes in sexual health as they age. One thing I've seen repeatedly is that when this particular muscle is retrained and strengthened, the improvements can be dramatic. Many men who believed their best years were behind them discovered that restoring proper muscle activation brought back firmness they thought was gone forever. What makes today's discussion especially interesting is that the method I'm going to explain takes only about 10 seconds. It's done right after you wake up, before you even sit up in bed, and when practiced consistently, studies suggest it can significantly improve erectile firmness for a large percentage of men. First, let's talk about what's actually happening inside the body. There is a muscle within the pelvic floor called the bulbocavernosus muscle. Think of it as a natural support system for erections. When this muscle contracts properly, it compresses the veins that normally allow blood to leave the penis. By restricting that outflow, the muscle helps trap blood inside the erectile tissue, which keeps the erection firm. When this muscle becomes weak, blood can escape more easily. Even if your body sends enough blood to the penis initially, if it doesn't stay trapped long enough to maintain strong firmness. That's why many men notice erections that are softer than they used to be or that fade more quickly than expected. The problem is that this muscle rarely gets used during normal daily movement. Walking, lifting objects, or exercising at the gym does not significantly train it. Over time, especially after the age of 50, it can gradually lose strength simply because it isn't being actively engaged. Researchers at a university medical program followed a group of men experiencing erectile difficulties for several months. They introduced a set of targeted pelvic floor exercises designed specifically to activate the bulbocavernosus muscle. After 6 months, the results were striking. Around 40% of participants reported a complete return to normal erectile function. Another 35% experienced clear improvements in firmness and consistency. That means nearly 3 out of 4 men experienced meaningful progress. When the researchers examined what separated the most successful participants from the rest, one pattern became very clear. The men who improved the most performed their pelvic floor activation immediately after waking up in the morning. Timing turned out to be extremely important. During sleep, the body follows a natural hormonal rhythm. Testosterone gradually rises overnight and usually reaches its highest levels in the early morning hours. By the time you wake up, your body is experiencing its daily peak of this hormone. However, after hours of sleep, your pelvic floor muscles are also completely relaxed. If you immediately jump out of bed and begin moving around, that brief window of peak hormonal activity passes without fully engaging the muscles responsible for erection support. By activating the pelvic floor before moving your body, you essentially synchronize muscle activation with your natural hormonal peak. This combination appears to help the body regain stronger control over blood flow during erections. Think of it like preparing an engine before driving. If you start the system properly, everything that follows tends to work more smoothly. Now let me explain the simple technique that many of my patients have used successfully. When you wake up in the morning, remain lying on your back for a moment. Don't sit up yet, don't reach for your phone, and don't swing your legs off the bed. Just stay still. Next, focus on the pelvic floor muscle. The easiest way to identify it is by imagining that you are trying to stop the flow of urine midstream. The gentle lifting sensation you feel in that area is the pelvic floor contracting. Once you identify the muscle, tighten it gently but firmly. Hold that contraction for about 3 seconds. It should feel controlled and steady, not strained or uncomfortable. After 3 seconds, Completely release the muscle and relax for 2 seconds. That completes one cycle. Now repeat that same pattern 2 more times. 3 seconds of contraction followed by 2 seconds of relaxation. 3 cycles in total. The entire process takes roughly 10 seconds. Although it seems simple, something important is happening during this brief exercise. By activating the pelvic floor before your body begins its daily movement, you send a neural signal that prepares the muscle to support healthy blood flow control. Over time, this consistent activation helps retrain the muscle to contract more effectively whenever erections occur. It's important to understand that improvement usually happens gradually. During the first week, most men simply become more aware of their pelvic floor. You may notice the muscle responding more easily when you contract it, but physical changes might still be subtle. By the second or third week, some men begin noticing slightly firmer morning erections or erections that last a little longer than before. For others, the changes appear as partial firmness returning after months of absence. Between weeks 4 and 6 is when many men report the most noticeable improvements. Morning erections become stronger, more frequent, and easier to maintain. In many cases, confidence during intimate moments improves as well because the body begins responding more reliably. One of my patients, a 64-year-old gentleman, told me he hadn't experienced a true morning erection in nearly 2 years. After practicing this short exercise every morning for just over a month, he began waking up with firmness again. He told me the change felt so unexpected that it boosted his confidence immediately. Stories like that are not unusual when pelvic floor training is done consistently. Consistency is the key factor. This technique only takes a few seconds, but the body needs repeated signals to rebuild muscle strength and coordination. The easiest way to stay consistent is to make the exercise part of your wake-up routine. The moment your eyes open in the morning, perform those 3 contractions before doing anything else. Many men are surprised when they learn how much influence the pelvic floor has over erection quality. Most people associate erectile strength only with hormones or blood circulation, but the muscular system plays an equally important role. When the pelvic floor becomes stronger and more responsive, the body gains better control over the mechanisms that maintain firmness. In the first part, I explained the 10-second activation technique that should be done immediately after waking up. That simple routine primes the muscle during the moment when testosterone levels are naturally highest. But strengthening this area further during the day can accelerate results. Once you begin practicing the morning activation, the next step is adding a few short training sessions throughout the day. These sessions are not complicated and they don't require any equipment. If you can perform them while sitting, standing, or even while watching television. The goal during the day is to gradually build endurance in the pelvic floor muscle. Instead of only 3 contractions like the morning exercise, if you perform a small set of repetitions, start by tightening the pelvic floor just as you did earlier, using the same sensation you would use to stop urination midstream. Hold that contraction for about 3 to 5 seconds. Then release and relax the muscle completely for another 3 seconds. That counts as 1 repetition. Perform 10 repetitions in a row. The entire set will take less than 1 minute. Try to complete 3 sets during the day, spaced several hours apart. For example, 1 set in the morning, 1 in the afternoon, and 1 in the evening. This pattern gradually strengthens the muscle fibers responsible for controlling blood flow. Just like any other muscle in the body, the pelvic floor becomes stronger when it is trained consistently. However, there is another important step that many men overlook. At night, before going to sleep, spend a short moment consciously relaxing the pelvic floor. This might sound unnecessary, but it actually prevents the muscle from becoming overly tight. When muscles remain tense all the time, they lose flexibility and proper coordination. Taking 30 seconds before bed to gently release tension allows the muscle to recover and function better the next day. Think of it as the recovery phase of training. Now let's talk about progress and what most men can realistically expect. When people begin a new health routine, they often hope for immediate results, but the body typically needs time to adapt. Pelvic floor muscles are no different. Strength and coordination develop gradually. During the first week, the biggest change you'll notice is awareness. Many men realize that they had never consciously engaged this muscle before. As you practice, the contraction becomes easier and more controlled. If by the second and third week, early physical changes may appear. Some men wake up with partial morning firmness that they haven't experienced in a long time. Others notice that erections during intimacy feel slightly stronger or last longer. The fourth, fifth, and sixth weeks are often where the most visible improvements occur. Morning erections may become more consistent. The firmness can feel noticeably stronger, and the body begins responding more naturally again. This is why I always encourage patients to commit to at least 6 to 8 weeks of consistent practice. Muscle strengthening and neural retraining require repetition. There are also a few mistakes that can prevent men from seeing the results they want. The first mistake is using the wrong muscles. Many men accidentally tighten their stomach, thighs, or buttocks instead of the pelvic floor. When you perform the exercise, the rest of your body should remain relaxed. Only the pelvic floor should contract. The second mistake is overdoing the exercises. Some men believe that doing hundreds of contractions every day will produce faster results. In reality, excessive training can fatigue the muscle and reduce effectiveness. A few focused sets are far more beneficial. The third mistake is inconsistency. Because the exercise is so quick, it can be easy to forget. But missing days slows down progress. The men who experience the best results usually treat the exercise like brushing their teeth, a simple habit performed every day. Another factor that supports stronger erections is healthy circulation. While pelvic floor strength controls blood retention, the body still needs good blood flow to begin with. That means maintaining healthy arteries and overall cardiovascular function. Regular walking, staying physically active, maintaining a healthy weight, and limiting excessive alcohol consumption all contribute to better circulation. When these lifestyle habits are combined with pelvic floor training, the improvement can be even greater. Sleep also plays a major role. The body produces most of its testosterone during sleep, particularly during deep sleep cycles. Poor sleep reduces hormone production and can weaken the body's natural erection signals. Aim for consistent sleep schedules whenever possible. Hydration and balanced nutrition also influence blood vessel health. Foods rich in antioxidants, healthy fats, and essential minerals help support the vascular system that supplies the pelvic region. When these elements come together, healthy circulation, strong pelvic floor muscles, and proper hormonal rhythm, the body regains much of the function that many men assume was permanently lost. One patient once described it in a very simple way. He said that before training his pelvic floor, his body felt like a system that had slowly lost its pressure. After several weeks of consistent exercises, he felt that pressure returning. His confidence improved along with his physical response. Confidence itself is another powerful factor. When men begin seeing small improvements, it reduces anxiety and performance pressure. That psychological shift can further support erectile function. The most important thing to remember is that morning erections are a natural indicator of male health. When they begin disappearing, it doesn't always mean something irreversible has happened. Often it simply means the body needs a little retraining. By activating the pelvic floor for 10 seconds each morning, strengthening it during the day, and allowing it to relax at night, you create a balanced routine that supports the entire system responsible for erection firmness. So starting tomorrow morning, when your eyes open, stay in bed for a moment and perform those 3 contractions before doing anything else. It takes only 10 seconds, but repeated daily, it can gradually restore the strength that supports healthy erections. Give yourself 6 to 8 weeks of consistent practice and observe how your body responds. Pay attention to the frequency and firmness of your morning erections because those signals can tell you a lot about your progress. If this information helped you understand your body a little better, let me know in the comments where you're watching from. I read every message and I enjoy hearing from viewers around the world. And if you want more practical, science-based insights on men's health and vitality, make sure you're subscribed so you don't miss future discussions. I'm Dr. Rebecca Stone, reminding you that sometimes the smallest daily habits can lead to the biggest improvements in your long-term health and confidence.